Have you ever wondered how a laboratory makes sure its results are actually correct? It's not just about the equipment, it's about having a system. Today, I'll be talking about quality system in chemical laboratories and why they matter in analytical measurements. In any chemical laboratories, the goal is always the same: to produce results that are accurate, reliable, and trustworthy. But how does a laboratory actually ensure that? The answer lies in having a proper quality system. In this presentation, I'll be covering what a quality system is, its main components, the benefits it brings, and how it is applied in chemical laboratories. So what is a quality system? By definition, a quality system in a chemical laboratory is a formalized framework of policies, procedures, and controls that governs how all analytical work is carried out. Now, why does this matter in analytical measurements? Because in analytical chemistry, even the smallest deviation in a process can compromise the accuracy, precision, and validity of results. A quality system acts as a safeguard, making sure that every measurement made in the lab can be trusted. A quality system is built on 5 components. First, the standard operating procedures, also known as SOPs. They are step-by-step guides that ensures every task is carried out the same way every time. Second, calibration and maintenance of instruments, which keeps all equipment functioning accurately and reliably. Third is staff training and competence. Every person working in the lab must know how to perform their task correctly. Fourth, record keeping and documentation, so that all processes are traceable, results can be verified. And finally, quality control, checks, and audits, which helps identify and correct any errors before they impact the final result. So what do we actually gain from having a quality system? The answer is simple. Everything becomes more reliable, more efficient, and more trustworthy. First, a quality system improves accuracy and precision. When procedures are strictly followed, measurements are more likely to reflect on the true value of what is being tested. This also leads to better consistency, meaning the same reliable results is produced every single time, regardless of who performs the test or when it is done. Second, having a quality system means fewer errors and fewer repeat tests. When every step is documented and controlled, mistakes are caught early before they affect the final result. This also ensures safety and compliance in the laboratory, ensuring that all work meets professionals and international standards such as ISO IEC 17025. And finally, perhaps the most important benefit of all, a quality system builds trust. Clients, lecturers, and regulatory bodies can confidently rely on data that comes from a laboratory with a strong quality system in place. Now, before we look at this chart, it is important to understand what ISO IEC 17025 is. It is the international standard that defines the requirements for testing and calibration laboratories. Laboratories that meet the standard are recognized globally as technically competent and capable of producing reliable results. This chart is based on a real study by Okezu and colleagues published in 2020 in BMC Health Services and Research. They examined a quality control laboratory in Nigeria, specifically under ANFDAC, which is Nigeria's National Agency for Food and Drug Administration and Control, before and after implementing ISO IEC 17025 accreditation. What they found was remarkable. Before accreditation in 2013, the laboratory had 93 total nonconformities. By 2017, that number dropped to just 7, and in 2018 it was 14, both significantly lower than before. Major nonconformities also dropped from 63 all the way down to 4 in 2017. This proves that implementing a quality system directly reduces errors and improves laboratory performance, which is exactly why a quality system is so beneficial. In practice, a quality system is applied at every stage of laboratory work. During sample preparation and analysis, analysts strictly follow standard operating procedures, or SOP, to ensure that every sample is handled, prepared, and tested in exactly the same way. This eliminates variability and reduces the chances of error before the analyst even begins. Now, once the analysis is complete, the results do not go straight to the client or lecturer. They go through a verification process first, where the data is checked, reviewed, and confirmed to be accurate before it is officially reported. This step is a direct result of having a quality system in place. And finally, a quality system plays a crucial role in maintaining laboratory standards overall. Laboratories that follow a structured quality system, especially those accredited under ISO IEC 17025, are internationally recognized as competent and trustworthy, giving their results credibility on a global scale. One of the most recognized symbols of this commitment to quality is the ISO IEC 17025 certification, which you can see here. In conclusion, a quality system is the foundation of every reliable laboratory. Its components work together to ensure accuracy, consistency, and safety in every analytical process. Without a quality system, even the best equipment cannot guarantee reliable results. In analytical chemistry, it is not optional, it is necessary.